All right, today we're jumping into a topic that has not only impacted millions of lives, but has completely reshaped the world of medicine. We're going to get a really solid handle on the basics of HIV.
So, let's just get right to it. We're going to start with the most basic question you can ask. What exactly is HIV?
And to really unpack all of this, we've got a little roadmap for our journey today. First, we'll cover the what and the how. What the virus is and its game plan. Then we'll get into how we detect it, how we fight back with medicine, and finally, what living with HIV looks like today and what the future holds.
Okay, first up, what is HIV? Let's define the virus and figure out exactly what system in the body it targets.
So right off the bat, the name itself tells us a whole lot. HIV, it stands for Human Immunodeficiency Virus, and its main target, well, it's the body's immune system, the very thing that's supposed to defend us from all kinds of infections and diseases. And if it's left untreated, the damage HIV causes can eventually lead to what's known as AIDS, or acquired immunodeficiency syndrome.
When you strip away all the complex science, the source material really boils it down to this one simple, powerful idea. HIV is a virus that hurts the body's immune system. It's direct, it's crystal clear, and honestly, it's the main thing we need to keep in mind as we go.
So now that we know what it is, let's see how this all plays out. On to our second section, how HIV attacks. Think of this as the battle happening inside the body, the virus going head-to-head with the immune system.
So, HIV has this really methodical four-step strategy. First, it goes hunting for a specific kind of white blood cell, a real key player in our immune defense, called a CD4 cell. Step 2, it gets inside that cell. Basically, it hijacks it. Third, it turns that poor cell into a little virus factory, just churning out copies of itself. And finally, and this is the devastating part, it kills the original CD4 cell and busts out, releasing all those new copies to start the cycle all over again. It's a systematic takeover. And that leads us right to the big problem here. You see, the body isn't just sitting there. It's trying to fight back, making more and more CD4 cells. But the virus, it's just relentless. And as this quote puts it, the immune system becomes weak when it cannot make enough CD4 cells to fight HIV. It's a numbers game, and the body just can't keep up. It can't produce new cells fast enough to replace all the ones being destroyed. Okay, to make this whole concept really click, the source gives us this brilliant analogy. Let's talk about a sink. Think of the virus making all those copies as the water constantly running from the faucet. Now the drain, that's your immune system, your CD4 cells, trying to get rid of the virus. When the virus is winning, it's like the drain gets clogged. The immune system just can't clear the water fast enough, so the water level starts to rise. That rising water level, that's what we call a high viral load.
Okay, so you've got this invisible battle raging inside the body. How in the world do we actually know what's happening? Well, that brings us right to section 3, detecting the virus. Let's look at how testing can reveal its presence.
Now, this part is super important because testing for HIV isn't a one-size-fits-all deal. For adults and older kids, the usual go-to is an HIV antibody test. Pretty straightforward. It looks for the antibodies your body makes to fight the virus. But, and this is a big but, for infants, that test just doesn't work. Why? Well, a newborn baby actually carries its mother's antibodies for several months after birth. So an antibody test might let up positive, but it could just be detecting the mom's antibodies, not an actual infection in the baby. That's why for infants, they use a totally different test, a PCR test. This one is way more direct. It looks for the actual virus itself in the blood. No confusion, just a clear answer.
Okay, so we've laid out the problem, we know how to find it, so what do we do about it? How do we fight back? This leads us to section 4, the counterattack, powered by medicine.
When it comes to treatment, the goals are actually really simple and direct. Goal number 1, lower the amount of virus in the blood. That's the viral load we talked about. And goal number 2, which happens as a result of the first one, increase the number of CD4 cells, which lets the immune system rebuild and get strong again. And look at this. We're back to our sink analogy, which perfectly shows how this works. On the left, you've got the problem, that high viral load, the overflowing sink. The water's coming in faster than the clogged drain can handle it. But on the right, that's the solution. The medicine acts like a powerful drain cleaner. It helps the immune system, our now unclogged drain, get the virus under control. And as it does its job, the water level, that viral load, goes way down. So what is this medical drain cleaner anyway? Well, the drugs are called antiretroviral medicines, and the name actually tells you what it does. Anti means against, and retroviral is just the scientific name for this class of virus. What these drugs do is they interrupt that copy and destroy cycle we saw earlier. They literally stop HIV from making new copies of itself, and that's how they bring that viral load down. And all of this progress brings us to our final section, which is really about the long game, living and looking forward. We're going to touch on management, research, and what the future looks like. You know, this quote here really gets to the heart of it because it treats the virus like a clever opponent. HIV is very smart. If given a chance, HIV will try to grow stronger. And that little sentence highlights something absolutely critical about treatment. You have to be consistent. If you miss doses, you give the virus an opening, a chance to mutate and adapt. It can actually become resistant to the very medicines that are supposed to stop it. It will always try to get stronger. But here's the good news. The fight against HIV is anything but static. The reason treatments have gotten so much better over the years is because of constant, ongoing research. This happens through studies called clinical trials. It's how scientists test new medicines, figure out which combinations work best, and make sure they're as safe as possible. It's a nonstop process of innovation. And that really brings us full circle. We've walked through the science, the attack, and the counterattack. So I want to leave you with this question to think about. How does having this clear, factual knowledge empower us to fight not just a disease, but also the fear and stigma that so often come with it? Thanks for joining me on this explainer.
Don't forget to subscribe for more health tips and updates.